Hi, my name is Carol Drexel, and I am a VP of Patient Education at Platform Q. I am joined today by Sanaz Eftekhari and Dr. Peter Leo. Sanaz is from the Asthma and Allergy Foundation of America, and Dr. Peter Leo is from Northwestern University. I would like to point out that the data that we are going to be talking to you today were supposed to be presented at the American Academy of Dermatology and at QuadAI last month, and those meetings were canceled, as you well know, because of COVID-19. But we wanted to make them available to you. This program was supported by independent educational grants from Sanofi Genzyme and Regeneron Pharmaceutical. And the goal was to provide education to bridge some of the educational gaps between patient and caregivers of patients with atopic dermatitis and their HCP in terms of bridging gaps in communication. As we well know, shared decision-making is not always practiced among patients with atopic derm and their physician. We designed 2 tracks of education. One was for clinicians, and it was posted on Immunology Live, one of Platform Q platform. And the second one was for patients, and was posted on the channel for eczema. I would like to say that this was designed as a tethered program in a way that each track had similar learning objectives.
The group of learners was pretty impressive, over 1,000 total learners. Almost 80% of them were MDs, NPs, or physician assistants. There were over 200 slide downloads and 777 polling responses. Now we can look at the healthcare practitioner results, and this is very interesting to see that 87% of them reported a practice impact, and 80% of those who had observed a positive impact felt that the participation in this educational activity had a positive impact on the patient's outcome or experience as well. So really quite a substantial majority found that this was helpful. Now, when we look at some of the text bubbles that came through in the form of quotes, we heard things like, "I've already helped several patients since the CME. We've improved management significantly. I was able to provide an effective therapy for an infant with atopic dermatitis." Very positive kinds of comments and outcomes that we were hoped for. When we look at the knowledge impact, it turns out that responses from all 4 of the CME test questions showed statistically significant improvement. 2 sample questions are demonstrated here, and we can actually see the effect during the pre-test versus the post-test, and then at follow-up, it seems even stronger. It's more reinforced at follow-up. And this particular question was looking at using dupilumab, one of the biologic systemic agents for atopic dermatitis, and we can see that confidence has improved in terms of healthcare practitioners selecting that as the correct answer. We can also see a question here about factors that should be considered when assessing the burden of disease, and again, we see that potentiation or improvement.
We're going to pivot now over to the patient education module, and like Carol said early on, this was designed so that the learning objectives matched those of the healthcare professional, one that Dr. Leo just talked about. So similar to the HCPs, we also saw really impressive program engagement on the patient side. We had over 5,000 total learners, with the majority learning through Facebook, which is where we as a patient advocacy organization and many other patient advocacy organizations focus our education efforts, because patients really are on Facebook, and it's a great area to reach them with these messages. We also did a 2-month post survey of the learners just to see what the impact was. And the majority of the patients who participated in this program did report positive impacts on communication and positive impacts on control. On the right side of the screen, you'll see some of the quotes that we pulled from the survey. These are themes that we also hear in AFA's patient community pretty regularly, that once these educational modules are used by patients, it really does impact positively their ability to communicate with their providers. And we're really excited to see this, especially because we've had these kind of programs in some of the other disease categories, and this was the first time AFA was doing this for eczema. So it was really great to see that there was a positive impact from the program.
It was actually very motivating to be partnering with AAFA on this very important initiative, and AAFA was able to give some very deep input into measurements and content, and that's probably why it was so successful. On this slide, we represented some pre and post and follow-up answers from the patient. And what you can see here right away is that our patients were very activated. Yes, of course. I mean, we partner with AAFA, and those patients came voluntarily to seek information. On the right is another response pattern about shared decision making. So this is clear. Patients want to have a shared decision making process with their clinician. But one of the things that we found among the clinicians is that clinicians totally underestimate adherence. What does this have to do with shared decision making? Well, one of the things we can say is that if clinicians were talking to their patient and really realizing a shared decision-making process, they would be aware that adherence was not as good as they think it is in their practice. So that's two other learning that we've got that I thought would be interesting to share.
Some of the questions that we heard during the program were really centered around patients who want to try to understand the triggers that are causing their eczema. And this is very common. When patients break out, they automatically try to look for what's the cause of this? What can I do? What behaviors can I change to stop some of the flares and some of the symptoms, some of the itching? So the questions that were coming up were pretty much in line with a lot of questions that we hear in our community. And also, you'll notice with some of these, it does touch on some of the comorbidities, like food allergies and other allergies that do tend to overlap often with eczema.
So here what you can see is the representation of the result to a questionnaire that is called the PAM, or the Patient Activation Measure. So what this questionnaire does is that it measures the patient as they journey through a level 1, which is not activated, to a level 4, which is very highly activated and taking charge of their care. So in green are the results in the low level and in the high level of activation prior to the education, and in blue is the result after the education. And what you can notice is that there were a displacement of a certain proportion of patients who were activated at the low level, which was 1 or 2, and they became more activated. As you can see, there was this 7% of patients who were in this 1 or 2 level in pre. They moved into 3 and 4 level, which was very very indicative of the power of the education.
So in summary, critical areas of communication and missed opportunities for shared decision-making were identified regarding atopic dermatitis manifestations and management. While healthcare practitioners demonstrate a low ability to utilize new targeted treatment approaches, sometimes, and what we saw initially, it does appear that once there is education, the awareness, acknowledgement, potential utilization of those increases. The data really does suggest that disconnect between perception of disease between the healthcare practitioner and the patient, and that shared decision-making approach is really hard if they're not connected and on the same page. Finally, while many caregivers and patients expect this shared decision-making approach, because of the low awareness among healthcare practitioners, it really is an important gap that we're hoping to further address. When taken together, I think this really tells us that there's still a lot of room to grow. There are still many miscommunications regarding this disease, and that education is so important for both practitioners and patients so that we can bridge these gaps. I want to thank everyone for coming. We really appreciate your time and attention. Thank you.